January 27th. There's a date to mark on the calendar in the COVID story. The World Health Organization is going to meet on January 27th to consider whether COVID-19 still represents a global health emergency. January 27th. Regardless of the decision on pandemic at that time, we know that many people will be dealing with COVID well into the future. We're getting new information all the time about long COVID. New research out of Israel, in fact, suggesting most of those people afflicted by long COVID symptoms will be able to recover. Our health reporter Lauren Pelly is with me this morning. She's been looking into this and has more on this new study. Good morning, Lauren.
So obviously we've been following this now for 3 years, as you said. January 27th is coming up, and we've been looking at the issue of COVID now since January 2020. So we have this huge body of data of people who've been infected. And we know at this point that most people with mild cases of COVID-19, even if they have lingering symptoms, they do tend to recover. But this subset of people who can develop long COVID, it can be such a range of symptoms, anything from losing your sense of taste and smell, all the way to debilitating intense fatigue. This new Israeli study that came out on Wednesday, this looked at a massive amount of people. 2 million medical records in Israel. What they found is that many post-COVID symptoms do linger after a mild infection for months, but most return to normal within the first year. Here's what the researchers told me.
There are patients who are experiencing long COVID symptoms for a year, and their life changes and they suffer. We do know that, but when we look at this large population and we look at their medical records, what we see is a small number of symptoms that last, and we see that they decrease with time.
Now, the team also told me that certain symptoms, including weakness and trouble breathing, may be more likely to persist.
So, Lauren, how does this new Israeli research compare to other studies we've seen thus far?
Well, it really reinforces a lot of the research that's been coming out in recent years. So, for instance, a Canadian study that came out last fall found around 3/4 of people with COVID recovered within a year. 25%, though, were still experiencing lingering symptoms of coughing, fatigue, breathlessness. Obviously, that can be quite life-altering for people if they're dealing with that for months and months, even years at this point. Now, I should note that most of this research that's coming out now is very backward-looking. So it's looking at the early years of COVID before we had the Omicron variant. That's what's circulating now, and it began to circulate a year ago, roughly. So all of this research isn't really necessarily applying to the variant that we're seeing right now. So all of these studies are still often ongoing. There'll be more data coming out just to see how the evolution of this virus might play into how long COVID actually develops. And the World Health Organization has been very vocal that we need to continue this research, given the amount of people around the world who are still suffering from this. Take a listen.
We need to better recognize what it is to describe it. We need much more research, and there's a lot of work in terms of setting up cohort studies around the world to follow patients over time in a systematic way, not just in high-income country, but in low-income countries as well, so that we can better track and understand progression.
Now, of course, a lot of people wonder, how do you avoid getting long COVID? Now, of course, avoiding catching COVID in the first place is very helpful, obviously, so using precautions that we all know well from several years of this pandemic. But we're also starting to see that vaccination seems to make a difference. So there's been several studies that have shown this, including this new Israeli paper looking at these 2 million medical records, showing that vaccination may help to reduce the risk of getting certain long COVID symptoms. Heather?
Lauren, thank you very much.